last video, we discussed a little bit about system selection and meaningful use, talked about the ONC certification program, and a little bit about MOTS versus COTS, the advantages of commercial vendor software. The development costs are lower, time is minimized, learning curve is easier, disadvantages, limited customization, even if it is a modifiable system. System selection. So I've not been involved in electronic medical records system selection. However, I was involved in the selection process for an e-learning platform for Ohio Health several years ago. We had a corporate university, and at this point in time, we were doing everything by paper, having somebody input from paper into an Excel spreadsheet the data of who had attended and who had not attended. So we were desperate to get some way of not only tracking people, but also remediating them on skills rather than just counting them as present. So the system selection process, we had to go through and look at a number of different vendors. We chose about 13 and sent out a request for proposal from those. And we decided what the goals were, determined the RFP requirements and who they were going to. Then it was reviewing the responses to the RFP. And let me tell you, they are very detailed in their RFP responses to your questions, and it does take quite a bit of time to synthesize through that RFP as what the capabilities are or are not for a system, much less to compare and contrast them. After that, we were able to determine that there were 3 vendors that we wanted to actually see and offered them the ability to come out and do a demonstration. And we also looked at their references, ranked our finalists, and we did a site visit and selected a finalist. So when we had 3 rooms set up with the different learning management systems, and we had a group of clinicians and non-clinicians come through and test each one, and we actually had the end users rate the functionality, because from the back end, all 3 systems met our minimum requirements. However, for adoption, what we wanted to do was to make sure that the end users, who were the clinicians and non-clinicians, the employees who were actually going to be utilizing the system, did like to use the system, did find it easy to use, had their questions answered. So that's how we ended up selecting a finalist. Then it was down to negotiating the contract. Now, any successful implementation of any system depends in part of an organization's ability to understand its challenges, and among those are resistance by clinicians, specifically for clinical documentation, the information structure in the system, the workflow, as well as the size of the healthcare organization and its resources. With clinician resistance, one of the ways around that is to find some strong clinical champion that's very well regarded by the clinicians as a champion, a vice president of nursing or a vice president of some other function in the hospital that is personally well regarded. That's going to be very key. The second thing is ensuring that we have user training and user training updates. But at the same time, we also want to identify super users. These are early adopters, people that have made noise about wanting to improve the system and now have an opportunity to be at the front of that. And of course, the buy-in is going to be important. So if you have the first 3 in place, typically the buy-in will follow. However, you need to make sure that you're looking at the workflow, the structure, and the size of the organization, because those are all changes. Those are all things that need to be managed. Glazer in 2009 actually put out an implementing EHR 10 factors for success, and you can read those here, but the important thing is from an upper level management perspective that we're linking the IT agenda to an organization's strategies. It's very important to have that IT governance that it was spoke about earlier in the course in place. And another one is the clinicians are continuously engaged in improving the systems and related workflows. They don't feel disconnected from the IT system or from the rollout or from the systems that they're using, that they're actually engaged with that, because it's very important to do that. And part of that, of course, is investment in the infrastructure. So not only are we investing in the infrastructure to make sure that our latency times are low, that people have a responsive system, but we need to also invest in the infrastructure to make sure that when new capabilities are rolled out, that those updates are getting rolled out to the people who are actually using them, that they feel like they have the support if there's a problem with passwords or with screens. Project managers are going to be key. Again, physician champion and sometimes nurse champion as a liaison to keeping them up to date on the project. And the staff, the healthcare IT leader and the builder customizing the software templates, drop-downs, the workflows. It's going to be very important to make sure that we have those people engaged as well. Clinical and administrative staff and training staff. Again, we're doing workflow design and we have a lot of people that are using the system. It's very important to make sure that people are all on the same page. So what do the characteristics of a team look like? Now, this is not just for healthcare IT strategic planning or EMR implementation or any implementation. This is the characteristics of teams in various industries in various situations. Group cohesion strengthened through camaraderie and involvement that develops over time. A shared purpose that clearly demonstrates that shared ownership. A high degree of mutual respect with acceptance of diversity and professional contribution. Establishing the goals that link the team's purpose with the outcomes. Team leaders who set and maintain structures for decision-making and conflict management. And then also regular patterns of communication whereby all members share ideas and information with each other. Communication-driven team looks at different perspectives of how a system will be used, has a wide variety or array of skills and knowledge, an ability and willingness to devote sufficient time to this implementation process, and consistently positive point of view towards the EHR implementation process. Maintaining the systems, again, after the application has been implemented, there's going to be a support team, and there's also got to be a way to prevent system errors, and we'll talk a little bit more about disaster recovery and about business continuity in a later module. But just a reminder, please review this lecture and the assigned articles and or videos. Please complete the assignments and the discussion by the due dates.